let's talk about circulating tumor DNA and some of the data presented at the San Antonio Breast Cancer Symposium. I get a lot of questions about ctDNA. Now, what it is that all of the cells in our body shed DNA into the bloodstream, and so can cancer cells. A lot of times we use a company called Signatera for ctDNA testing, and what Signatera does is they actually develop a personalized assay for each patient based on their tumor's mutation signature, and then you can check for that in the blood. So it's, a thought of like, can we use ctDNA to detect minimal residual disease or to detect a molecular relapse, before it becomes apparent on imaging. So that's where a lot of the current research is. So lots of data ongoing on this, but let me tell you about a few key studies presented at SABCS today. The first study was presented by Dr. Stephanie Graf, and it is a subset analysis of the Monarchy trial. The Monarchy trial looks at adding abemaciclib or Resideo to patients with high-risk hormone receptor positive HER2 negative breast cancer. And they had 178 patients, and they tested ctDNA at 0 months and at 24 months. 0 months was when they entered the trial. So they had done chemo, if they were getting it, radiation, surgery, and they were kind of starting their endocrine therapy. And at 24 months, they had 42 patients out of 178 who tested positive, and all 42 of them later experienced a recurrence. In contrast, at the patients who did not have a positive ctDNA detected, only 21% of them later experienced a recurrence. So that was really quite striking information. There was a similar study presented by researchers in Germany, looked at patients with stage 1 to 3 breast cancer, and they tested ctDNA about 24 months after adjuvant chemotherapy. And what they found was that detection of ctDNA was associated with a nearly 14-fold increased risk for distant recurrence. Lastly, there's another study presented by Dr. Laus Pustai, and his team is actually looking to see if we can make a change in treatment for patients with a positive ctDNA result. What they're doing is they have a cohort of high-risk patients based on things like positive, high grade, multiple lymph nodes, high oncotype score, among other things. And they're testing ctDNA every 6 months. And if you test positive, you have scans. And if your scans are negative, so positive ctDNA, molecular relapse, but no clinical evidence of relapse on scans, they're getting randomized to either continue on current treatment or switch to a different treatment with fulvestrant and palbociclib. And the idea behind this is, can changing of therapy at that time of a molecular relapse, so the time of a positive ctDNA, can it delay or prevent a metastatic recurrence? Lots of information here, and I think where we're heading with this is that, ctDNA monitoring really may provide an opportunity to detect molecular relapse before clinically apparent imaging. We really need good assays because obviously we saw some people who recurred did have a negative ctDNA. So it is not perfect by any means. I think that's really important. We need more work there, and we need studies like the DARE trial, that's the one where they're changing the therapy, to guide us as to what we do when we have a positive ctDNA, because otherwise we don't really know yet what to do with it. So that's the latest update. ctDNA testing is still not routine in the office outside of a clinical trial, but there are certainly situations where it may be used. I'd love to know your take, your questions. Happy to answer them.